Hi class, in this section of the rehabilitation engineering, we shall discuss the occupational therapist, the prosthetist and the orthotist, the rehabilitation nurse and the speech pathologist. So all these people, they are members of the paramedical team. So we shall discuss their role in a rehabilitation team in detail. So, occupational therapy, according to WHO, is the art and science of directing man's participation in selected activities to restore, reinforce, and enhance function or performance or decrease disability, and thus to promote health. That is occupational therapy, according to WHO. So, the function of an occupational therapist, or OT, as we shall call them, evaluates and trains an individual to perform day-to-day activities such as dressing, eating, personal hygiene, etc. So these are also called the activities of daily living. So they aid in maintaining and improving the range of movement of the joints, muscle strength, endurance, and coordination of the upper limb. This helps a patient to explore their vocational skill and avocational interest. Therefore, an occupational therapy also works closely with an occupational therapist to deliver the best possible treatment to a patient. So all these treatments are customized according to the individual's requirement and individual symptoms. So for people who are confined to their home, the OTs visit them and then provide training related to management skills and using simple self-help aids to minimize fatigue and conserve energy. So they just teach them how to do a work quickly and efficiently with whatever is available around their house. Already a handicapped person would be spending a lot of money in their treatment. So the occupational therapist would go home and suggest small modification, but not massive ones, because it is going to add to the expense of the individual. So for severely disabled, severely handicapped, and upper limb amputees, the occupational therapists provide training in the functional use of the prosthesis. So for an amputee or severely handicapped person, often an orthosis or a complex orthosis or a prosthetic prosthesis is used to assist them in performing certain tasks. So, an occupational therapist would actually provide training in using these processes functionally, and how they can use the processes in the environment that they're living in, and they collaborate with the physiotherapist in achieving set goals using activities. So, activity based goals are set for the patient instead of movement based goals. And then, occupational therapists also collaborate with the orthotists in making splints that would assist the patient in performing functional tasks. So the role of a prosthetist or an orthotist is to produce customized design, fabrication, and fitting of a prosthetic brace or an orthosis. So if there is a person with a handicap, then an orthotist or a prosthetist actually customize a rehabilitation device according to their requirements, and help them improve their functionality. So these orthotists and prosthetists actually coordinate with other members of the rehabilitation team in order to understand the patient's requirement and select the best possible appliance for an individual. For some examples of orthosis devices are ankle arch supporters for people who have flat foot or people who have walking disabilities, ankle foot orthosis for people who do not have really stable ankle, or wheelchair seating for for paraplegics basically. So the ergonomically comfortable seating for wheelchair, as well as a seat that would uh, prevent or that would reduce the chances of pressure sores. All these devices are customized according to the individual's requirement by an orthopedist. So a rehabilitation nurse is actually responsible for quite a lot of function. So his or her main function is to maintain the health of a bedridden person. So, in order to make sure that a bedridden person is healthy, the rehabilitation nurse does certain things, or make sure that a bedridden person is leading a healthy life. So, other functions of a rehabilitation nurse include transferring the patient to and from the bed to the wheelchair or the chair or the couch, wherever they want to be seated. So, other Another function is assisting them in their activities such as sanitation, heat, and environmental conditions like heat and noise, or control of their personal properties, hygiene, and safety. So, if the patient is really hot, or if the environment is noisy, then the nurses actually assist them in like try and make the environment conducive for that particular patient. So, the rehabilitation nurse is also responsible for using and maintaining the adaptive equipment that patient requires to communicate, eat, move, defecate, dress, and ambulate. So, this include their maintaining their wheelchair, their cutlery, their dress, and so on. The nurse is also responsible for performing specific preventive measures to minimize the effect of inactivity and promote independence. One such example is turning a bedridden patient around to prevent bed sores. Occasionally just keep turning them to prone and supine position, applying powder or other preventive medications for pressure sores, applying electrodes and neuromuscular stimulation to stop the muscle from being atrophied. These nurses are also responsible for integrating various therapies into a patient's daily activity. So, certain therapeutic session as the therapeutic exercise would actually reduce the effects of being bedridden in a patient. So, these nurses they train the patient to do these exercises or therapeutic procedures as their daily activity. They also track the medication of the particular patient and then schedule routine follow ups. The last person that we are going to introduce in this session are the speech pathologists. Now, the role of a speech pathologist include evaluation and treatment of neurological communication problems, vocal re-education, preoperative counseling prior to laryngectomy, glossectomy, and other procedures that will potentially influence communication abilities, laryngeal speech training, retaining speech impairment with intraoral defects, cognitive retraining, training the patient in use of communication devices, patient and family education, and evaluation of swallowing function and management of dysphagia. Now, basically, let us take the example of a stroke patient. Now, often you see that a person who has suffered stroke cannot, articulate very clearly. Occasionally, they have a condition called dysarthria, which means their vocal cord is not, it's a vocal cord disorder, neurological condition that affects the vocal cords, and that can be as a result of stroke. Now, a speech pathologist is actually responsible for speech rehabilitation or educating the patient to use to try and speak as clearly as possible or facilitate the use of certain devices such as the text to speech converters or the speech enhancers to try and help them communicate better. So these device, the text to speech converter, or yes, text to speech converter or the speech enhancer, actually takes either text input from the patient or takes their voice input as such, and then does some signal conditioning and produces a speech that is legible to a normal person. So a speech pathologist also gives them training how to talk properly or how to communicate properly. So it's just a set of retraining that a person undergoes in order to live with their disability but communicate effectively with the general public. I think that's all we have time in this session. I shall see you again in the next session with more rehabilitation team. Thank you very much.